Hello, and welcome to our channel. If this is the first time you are visiting our channel, please consider subscribing. We create and share high-quality and informative medical videos that will help each one of us make healthy choices and decisions in our daily life. We welcome all of you and appreciate your support and encouragement. We are committed to producing more medical videos that will benefit all of us. Thank you. Hey there viewers. Welcome to our channel. In today's video, we will talk about ovarian cancer. Here are the 10 questions and topics we will be covering in this video. From the answers to these 10 questions, I promise you will surely discover some life-saving facts and tips about ovarian cancer that you need to be aware of. So, make sure you watch till the end of this video. So, here are the questions. Number 1. What is ovarian cancer? Number 2. Why are we talking about ovarian cancer? Number 3. What are the 3 types of ovarian cancer? Number 4. How is ovarian cancer diagnosed? Number 5. How fatal is ovarian cancer? Number 6. What are the top 5 signs and symptoms of ovarian cancer that you need to be aware of? Number 7. What are some complications of ovarian cancer? Number 8. What are some risk factors for developing ovarian cancer? Number 9. What are the top 5 tips to reduce the risk of ovarian cancer? Number 10. What is the role of flavonoid diet in ovarian cancer? Now that we went through the questions we will be covering in this video, we can get started answering them. So, what is ovarian cancer? First, let's talk about ovaries and their role. The ovaries are part woman's reproductive system, and there are 2 of them. They are located on either side of the lower abdomen. At the midpoint of each menstrual cycle, these 2 ovaries produce and release eggs into part of the female reproductive tract, the fallopian tube, where fertilization by a sperm may occur. Where does ovarian cancer occur? Ovarian cancer starts inside the ovaries and then becomes a cancerous tumor that grows outside the ovaries, and the cancer cells divide uncontrollably. This is when it destroys nearby tissue or even spreads to other parts of the body, such as the liver, lungs, spleen, uterus, bladder, sigmoid colon, intestines, brain, and other organs in the body. So, why are we talking about ovarian cancer? Ovarian cancer is considered one of the silent killers. This is because women who have cancer may not be aware of it until it spreads to other organs in the body. Therefore, it absolutely makes sense to take preventative measures because of its high mortality rate, particularly if you have a family history of this cancer. Ovarian cancer affects around 22,500 American women each year, according to the American Cancer Society. Also, according to the National Library of Medicine, ovarian cancer affects around 7,500 women in the United Kingdom every year, and also 6 in 10 cases of ovarian cancer are diagnosed in the later stages, stages 3 and 4. Know that we defined ovarian cancer. What are the 3 types of ovarian cancer? Ovarian cancer is categorized based on where the cancer started. Therefore, these are the 3 categories. Number 1. Epithelial tumors. These tumors start in the thin layer of tissue that covers the surface of the ovaries. Epithelial tumors represent up to 90% of ovarian cancers. Number 2. Stromal tumors. These tumors are known to be diagnosed at an earlier stage of cancer in comparison to ovarian tumors. These tumors start in ovarian tissue and represent about 7% of ovarian tumors. Number 3. Germ cell tumors. These tumors start in the egg-producing cells. These types of tumors are scarce and known to occur in younger women. Now that we know about ovarian cancer and its categories, we can move to talk about some diagnostic techniques and technology that specialists use. So, how is ovarian cancer diagnosed? For ovarian cancer diagnosis, a doctor may use many different types of tests and exams. Number 1. Pelvic exam. The purpose of this exam is to check any visible abnormalities. This exam involves checking the vulva, vagina, cervix, ovaries, uterus, and rectum. Number 2. Imaging tests. These tests include ultrasound, computed tomography, positron emission tomography. These tests show the size and the shape as well as the structure of the ovaries. These tests also detect any pelvic masses. To determine if ovarian cancer has grown and spread, the doctor uses colonoscopy, chest X-rays, magnetic resonance imaging, also called MRI. Number 3. Blood tests. In the blood of ovarian cancer patients, there may be high levels of certain tumor markers in the blood, such as CA125. This is the protein that is found on the outside of ovarian cancer cells. Therefore, this blood test confirms the existence of this protein. This blood test is also used to detect chorionic gonadotropin, alpha-fetoprotein, and lactate dehydrogenase in the blood. Number 4. Biopsy. This biopsy test is mostly used to make a definitive diagnosis after completed the above-listed tests. This is when the doctor obtains tissue and abdominal fluid samples for the pathologist to examine them closely using a microscope to determine the presence of cancerous cells. Know that we know the 3 types of ovarian cancer and how it is diagnosed. How fatal is ovarian cancer? As I mentioned before, ovarian cancer can spread very quickly to other organs. This is because its symptoms can be mixed up with other health conditions or illnesses. This makes it very challenging to detect and diagnose, which leads to delay in medical interventions and treatments, and therefore it spreads to other organs in the body. And this is when the cancer becomes fatal. Whenever we develop a health condition, our body gives us some crucial signs and symptoms that we need to watch for. So, what are the top 5 symptoms of ovarian cancer that you need to be aware of? Number 1. Pain. The types of pain we are talking about here are unexplained cramps, painful pressure in the pelvic area, abdomen, or stomach. These types of pain can be continuous and severe. This is when you seek medical attention and intervention. Note, never assume these symptoms are related to your menstruation. Thus, make sure you get medical advice from your doctor. Number 2. Urinating more frequently than usual. This is one of the direct effects of ovarian cancer, and this is when you feel the need to urinate more frequently, but little comes out when you go. You may even experience difficulty in holding urine on your way to the bathroom, and also urges can come on quickly. You may also experience urinary leakage without even trying to pass urine. Note, frequently urinating may also be associated with a urinary tract infection, UTI, or an overactive bladder. However, If this sign is a new health condition to you and continues for days, make sure you seek medical advice from your doctor because it can be serious if ignored, being one of the signs of ovarian cancer. Number 3. Unexplained bloating and abdominal distension. Ovarian cancer can produce gas and block it from being released, leading to abdominal bloating that can be uncomfortable. If this symptom is new to you and persists for days, make sure you seek medical advice. This is because bloating can be associated with fluid buildup in the abdominal cavity at the end stage of ovarian cancer. The degree of abdominal distension may range from mild to severe, accompanied by mild indigestion. This bloating mostly occurs daily, and it can even get worse with time. You may not be aware of this bloating until it is too late. Therefore, it is crucial to pay attention to your clothes and check if they are tight around your waistline, knowing that you haven't gained any weight recently. Note: if you developed unexplained and expecting abdominal distension, you may develop stretch marks. Also, never assume that the bloating you are suffering from is related to age, or menopause, or from gaining a couple of kilos. This is because unexplained bloating can be an early sign of ovarian cancer, especially if you feel bloated for more than 2 days. Therefore, if you ignore this symptom, it will lead to serious and complex health conditions. Number 4. Unexplained lower back pain. If this sign is new to you and you didn't have problems with back pain before, this may be a serious sign that you need to pay attention to, especially if it is similar to labor pain. This is because when cancer spreads outside of the ovaries, it causes lower back pain, and this pain is mostly from tumor growth and the tumor compressing on other organs in your body. Number 5. Constipation. This symptom is often overlooked by so many women, associating it with other health conditions or food-related problems. However, when the ovarian tumor spreads, it can cause constipation, and this is by putting pressure on the bowels. Therefore, constipation is a typical sign of ovarian cancer. Thus, it is very critical to pay attention to any changes in your bowel habits, especially if it is new constipation that doesn't go away, even with interventions that you may have tried. Number 6. Vaginal bleeding. The bleeding we are talking about here is the bleeding that is no normal, such as heavy bleeding, irregular bleeding, and bleeding between periods, particularly after menopause. You may even experience frequent discharge from the vagina, and the color of this discharge can be clear white or colored with blood. Number 7. Pelvic pain or pressure. This is a very tricky symptom because it resembles the pain you would get when you have menstrual cramps, but this pain can be an early sign of ovarian cancer. This kind of pain may be confined to one side, but can also be felt all over your pelvis. Therefore, make sure you consult your doctor if this pelvic pain persists for a few days, particularly if accompanied by a feeling of pressure in your pelvis. Number 8. Pain with intercourse. This is called dyspareunia, and it is a common sign of ovarian cancer. However, this symptom can also be related to pelvic inflammatory disease. Therefore, it is best to always consult your doctor for a proper diagnosis. Suffering from any cancer results in some complications that can be very challenging to deal with medically. So, what are some complications of ovarian cancer? Ovarian cancer can be very severe when it spreads to other organs in the body, leading to some complex complications. Thus, it is vital to be aware of the complication of ovarian cancer and seek medical interventions and treatments as soon as possible. Some of these complications are: Number 1. Bowel obstruction. When ovarian cancer spreads to the abdomen and pelvis area, it leads to bowel obstruction. This is when you feel crampy abdominal pain and even vomiting. Number 2. Perforated colon. When ovarian cancer metastasizes into the intestines wall becomes weak, which leads to bowel perforation. This is when bowel contents leak into the abdominal cavity, leading to an infection called peritonitis. Number 3. Blockage of a ureter. When cancer spreads to the pelvis areas, it leads to the blockage of the tubes that travel from the kidneys to the bladder. These tubes are called the ureters. If both of these tubes are blocked, urine output will drop, leading to urinary retention. Number 4. Pleural effusion. When cancer spreads to the lungs and the chest area, cancer causes the fluid, sometimes containing cancer cells, to build up between the membranes that line the lungs. This is when the specialist performs a procedure called thoracentesis, where a needle is placed through the skin on the chest into the pleural cavity so that the fluid can be drained safely. Depends on the situation, the specialist may place a stent to allow the continuity of the fluid drainage. Knowing that most women get ovarian cancer without being at high risk, so, what are some factors that may increase the risk for developing this cancer? Some of the risk factors that may increase the risk of developing ovarian cancer are: Number 1. Even though all women are at risk of developing ovarian cancer regardless of their age, ovarian cancer rates are highest in middle age or older. Number 2. If you have one of your family members who have had ovarian cancer. These may include your sister, aunt, or grandmother on either your mother's or father's side. Number 3. If you have an inherited genetic mutation in one of two genes, breast cancer gene 1, BRCA1, or breast cancer gene 2, BRCA2. These genes are accountable for about 10 to 15% of all ovarian cancers. Number 4. If you previously had breast cancer, uterine cancer, or colon cancer, you are at high risk of developing ovarian cancer. Number 5. If you have never given birth or have had difficulty getting pregnant. Also, having your first child after the age of 30 may increase the risk of developing the cancer. There are no known ways to prevent ovarian cancer completely. However, certain things may reduce the risk of developing ovarian cancer. So, what are some ovarian cancer risk-reducing factors that you should be aware of? Number 1. Diet. It is crucial to know that eating an overall balanced diet and maintaining a healthy weight are critical dietary factors in reducing the risk of developing ovarian cancer. When you combine an active lifestyle with certain foods, this will reduce the risk of developing this cancer. The types of food we are talking about here are foods that are high in vitamin D, such as salmon, beans, eggs, nuts, and cod liver oil. Also, other types of food you would want to integrate into your diet are vitamin A-rich foods, such as carrots, leafy greens, and sweet potatoes. Note, any food you integrate into your diet, make sure you consume them in moderation, because overeating them can lead to counter effects that would affect your health. Number 2. Oral contraceptives. According to the American Cancer Society, women who used oral contraceptives for 5 years or more have about a 50% lower risk of developing ovarian cancer than women who never used them. However, it is vital to make sure you consult your doctor before you start taking oral contraceptives, because they have side effects that you need to be aware of. Number 3. Avoiding carcinogens. Carcinogens are substances that can cause various cancers. One of these substances is talcum powder. The International Agency for Research on Cancer classified talc-based powder use on the genitals and buttocks as possibly carcinogenic to humans. Talcum powder is found in everyday products such as baby powder, vaginal deodorants, and makeup. Therefore, avoiding carcinogens could decrease your risk of developing ovarian cancer. Number 4. Hysterectomy. This surely lowers ovarian cancer risk with or without oophorectomy. Oophorectomy is the surgical removal of the ovaries. Number 5. Breastfeeding. If you have done breastfeeding for at least a year, this lowers the risk of developing ovarian cancer. According to the Cancer Network, breastfeeding is found to be associated with a 24% lower risk of invasive ovarian cancer. Now that we went through some risk-reducing factors of ovarian cancer, what is the role of flavonoid diets in ovarian cancer? Camphorol play a big role in inhibiting the growth of ovarian cancer. Camphorol is a natural flavonols, which have been found to have anti-cancer activity. This is because they have the ability to inhibit cell proliferation, angiogenesis, and metastasis while promoting apoptosis, which is a process used to clear the body of cells that have been damaged and that are beyond repair. Some fruits and vegetables that are rich in flavonoids include berries, Brussels sprouts, broccoli, cabbage, grapefruit, kale, onions, apples, tomato, red grapes, tea, and more. Here are some questions to think about in regards to ovarian cancer. Number 1. Do you think ovarian cancer affects pregnancy or will affect the growing baby inside? Number 2. Do you know of some food that you think would slow the growth of this cancer? Please share your experience in the comments below. Please don't forget to like and subscribe to our channel. Thank you.